Dr. Hannah West.
I'm Dr. Laura Thomas.
And our research is working towards better understanding bowel cancer. Bowel cancer is the second leading cause of cancer-related death in the UK. 35% of cancers are thought to have an inherited component. We know about some of the genetic causes of bowel cancer. However, for some people, a genetic cause remains unknown.
We would like to help these patients by getting a better understanding of the genetic causes of bowel cancer. The colon and rectum make up the large bowel, which is the last part of the digestive tract. Bowel cancers begin to develop when the normal tissue that lines the bowel grows uncontrollably. Precancerous polyps can form due to this uncontrolled growth, with larger numbers of polyps and the development of very big polyps giving the greatest risk of a polyp developing into a cancer. Patients with some genetic conditions will develop lots of polyps due to a mutation that they carry. These patients are at 100% lifetime risk of developing bowel cancer.
By reading the DNA of these patients using a technique called sequencing, we hope to find new genes which could be involved in the development of bowel cancer. By better understanding the genetics of bowel cancer, we hope to improve the care of patients and their families who are affected by bowel cancer.